Hi everybody, my topic is Ribavirin for chronic hepatitis E virus infection in transplant recipients and immunotherapy in renal cell carcinoma. Definition, hepatitis E virus is a considerable pneumopath single strange RNA virus that is approximately 27 to 34 nm in diameter. It has been classified as a single member of the genus Epivirus in the family Epiviridae. The antiviral drug Ribavirin can cure chronic hepatitis C virus in solid organ transplant recipients, research reported.
So now let's meet some patients so we can put to work what we have learned about hepatitis E diagnostics. Our first patient is Hannah. She feels sick and had to vomit at home. She's feverish and her skin has a yellowish color. Her symptoms started 1 week ago. 4 weeks ago, she came back from Mexico when she visited family. Obviously, we think about hepatitis. Let's order lab tests. In Hannah's lab report, we can see that her liver enzyme function is significantly elevated. Furthermore, her hepatitis E tests are positive. Hepatitis E RNA is also detectable. So what's your diagnosis? Hannah has no history of immunosuppression. So let's take a look back at the graphic dealing with immunocompetent patients. Her ALT is very high, which signifies serious liver damage. Anti-HEV IgM and IgG are both positive, and we could detect RNA in Hannah's stool. Based on these results, we can conclude that Hannah is most likely in the early phase after infection. So Hannah is suffering from an acute hepatitis E infection. Let's see our next patient. Our second patient is Pete. He suffers from abdominal pain of recent onset. In the lab report, we can already see elevated liver enzymes. Pete received a lung transplant 8 years ago. Currently, he is on immunosuppressive therapy. Furthermore, he tells us that he's a passionate hunter. Based on Pete's history, we include hepatitis E screening in our lab report. We can see that his liver enzyme function is significantly elevated. His anti-HEV antibodies are negative. However, the lab detected HEV RNA in Pete's stool. What does that mean? Since we know that Pete is taking immunosuppressive medication, we should consider this in interpreting his lab results. We know that immunocompromised patients can have problems producing antibodies to the virus. So in Pete's case, it is essential to measure RNA. His lab report shows elevated ALT levels as a sign of liver damage, but negative antibody tests. However, there is RNA detectable in his stool. Pete is suffering from an active, ongoing HEV infection. Based on the laboratory findings, we cannot determine when Pete was infected. It may have been recently or more than 6 months ago. However, it is not important to know that. What is important is that Pete gets appropriate treatment and follow-ups. Congratulations! Now you can handle hepatitis E lab results.
So I hope you liked this video.
Application in medicine, hepatitis A virus infection is usually self-limiting, except in patients with a suppressed immune system, where it can build up to chronic hepatitis and cirrhosis. Pros and cons. Pros, Ribavirin is a general antiviral that inhibits replication for many RNA and DNA virus. It has long been used to treat hepatitis C along with pegylated interferon alpha and now several direct-acting anti-HCV agents. Cons. Ribavirin is a safe treatment option for hepatitis E virus infection. However, the optimal dose of Ribavirin for the treatment of chronic hepatitis C remains to be determined as the treatment failure might occur.
Hey, thank you for watching Medicosis Perfectionalis. Hepatitis E mnemonic. The E mnemonic, also known as the EW mnemonic, coming up. Hepatitis E. Remember, EW. It causes jaundice in the Far East, Egypt, and by Egypt I mean Africa. And by the way, Egypt is my home country. India, Central America, contaminated water. Ew, contaminated is ew. Undercooked seafood. Sometimes some genotypes of Hep E are endemic in the swine. So undercooked pork can cause Hep E, hepatitis. So swine, pigs eat everything, including garbage and worms. So that's ew. No offense to pigs. Fecal oral route of transmission. Sometimes it's common in pregnancy. And when it comes to pregnant women, it's fulminant. Fulminant means massive necrosis, which can lead to failure. Ew. And there is marked cholestasis in hepatitis E. Mostly it's acute. In these countries, sometimes it's the most common cause of acute viral hepatitis. Wow. But, however, it also can be chronic, such as patient with HIV or patient with immunosuppression. Some textbooks, including Harrison's, which is my favorite book, I will link it in the description, it regards Hep E as an opportunistic infection for people with HIV. So, acute will have IgM antibodies in the blood, and chronic will have anti-HEV IgG. It's very similar to Hep A on electron microscopy. To remember that A and E are both vowels. Okay? Remember Hep D was dependent on whom? On Hep B. So you can draw D like this, and you have B, and A and E are vowels, so they go together, and these go together. Anyways, so that's it. Now you know everything you need to know about hepatitis E. But wait, there is more. And now, question of the day. Which type of hepatitis is the most commonly associated with sexual exposure? Is it Hep A, Hep B, or Hep C? By the way, if you go to my Facebook page, there's an album there, contains all of the questions. This is the 4th question. So if you need to get them all, go to my Facebook page. Now, all you need to know about Hep E. Please.
Okay. Definition about renal cell carcinoma is the third type of urologic cancer and has a poor prognosis with 30% of metastatic patients after diagnosis. The angiogenics and targeted immunotherapies led to treatment remodeling and emphasizing the role of the tumor microenvironment. However, long-term response are rare with a high rate of resistance. New strategies are emerging to improve the efficacy, and the emerging drugs are under evaluation in ongoing trials. With the different treatment options, there is an urgent need to identify biomarkers in order to predict the efficacy of drugs and the better strategy patients. Application in medicine, well, the treatment and management of metastatic have radically changed over the past 20 years. Initially, first generation immunotherapy with cytokines, interleukins, of interferons, representing a standard approach but with poor results. The development of tyrosine kinase inhibitors, mainly vascular endothelial growth factor receptor inhibitors, largely improved the prognosis of bad progression, free survival, and overall survival.
The combination in immunotherapy are focused on the first line, and clearly it's the future. It's already the standard treatment with double IO, IO TKI. But the main point, we have two challenges. First, we have to know how to select the good combination for the good treatment for the good patient, and we have IO or IO TKI, and we don't really know. We need biomarkers to identify a patient who will derive any benefit from this combination, and in order to identify this kind of biomarker, we launched in France a randomized phase 2 trial called Bionic, and we select patients based on molecular groups defined on frozen tumor samples, and based on these molecular groups, we allocated treatment double IO nivolumab ipilimumab or nivolumab alone or TKI alone. And with this kind of approach, I think we are going to find some biomarkers of response, and the trial is closed, the inclusion of the trial are closed, and so we plan to show the first result, I think, at the end of the year at ESMO Congress, and we will see if we can try to find the good biomarkers to respond to this treatment, because we have a challenge on toxicity concern, of course, and we need this kind of biomarker-driven trial.
Pros and cons. Pros: identifying biomarkers is the key to better select treatment, reduce costs, and improve survival in patients with metastatic kidney cancer. However, the limitation of the most studied biomarkers, PD-L1, immunohistochemistry, and 10-MB make necessary the identification of robust markers. New technologies could help in this purpose. Cons. Well, the sarcomatoid component can be found in all the histology subtypes and demonstrate increased tumors mutations burden, with high frequency of P153, CDKN2A, and NF2 mutation, and also genes involving the chromatin remodeling such as RRD1A and BAP1.
I think when we look at the treatment for advanced renal cell carcinoma, it certainly has changed significantly. In past several years, renal cell carcinoma doesn't respond to traditional cytotoxic chemotherapy, and we had the advent of the first target therapies with the VEGF TKIs, over now, I guess, close to 15 years ago, that really showed an improvement in progression-free survival. And then for a while, that was the mainstay. And then, back in 2017, we saw the first data showing that immunotherapy has a role in the frontline treatment, with the presentation of that for Nivo and Ipi showing improvement in overall survival and immune poor risk versus sunitinib. And then since then, we've had other VEGF IO combinations with both axitinib pembrolizumab and axitinib avelumab approved by regulatory agencies, given, in the case of axi-pembro, improvement in overall survival and progression-free survival, versus sunitinib in all patients in the risk group, and with axi-avelumab improvement in progression-free survival. And so, there's a wide variety of options to offer our patients now, with, I think, TKI monotherapy being used less and less, given this data, and both, Nivo, Ipi, Axi, Pembro really becoming a new standards of care, given the overall survival benefit in patients with renal cell carcinoma.
Issue playing in Ecuador, the most common carcinoma in the different subtypes of kidney cancer is clear cell. Among the most important occurring risk factors such as tobacco are being overweight in Ecuador, in addition to hereditary predisposition. Since there is a silent tumor, the specific treatment, total or partial nephrectomic, is today the only curative treatment of kidney cancer. In recent years, research and events in molecular biology allow us to know which pathways are altered in this tumor, and to design drugs direct against proteins abnormally expressed in these pathways that have achieved an important advance in survival for metastatic patients.
So it really, as I was mentioning, has been transformative for the care of patients with advanced RCC. And it's not sort of a new therapy either. We think of immune therapy in kidney cancer, and it's not that long ago that it was the cytokine era, things like interferon and high-dose IL-2. And then in the mid-2000s, the introduction of anti-angiogenics or blood vessel blocking agents really transformed the management of kidney cancer at that time, and patients were living longer. And what we've seen more recently is with the introduction of immune checkpoint blockade, not just by itself, but often in combination with other drugs, has really led to dramatic responses in a number of patients. I think what's most exciting is it's not only that more patients are responding and more patients are living longer, that's tremendously important, but that we're seeing, hopefully starting to see at least, a tail of the curve, meaning that some of these patients really do seem like they have long-term or durable responses. And so the hope is not just to get better and better treatments, but actually to try to get to a point where we're having a lot more long-term survivors with kidney cancer. And the ultimate goal is cure and getting towards that goal for more and more people.
Conclusion, well, renal cell carcinoma include distinct entities with specific molecular alterations. Among them, ccRCC, the most frequent, is particularly characterized by it is angiogenic and immunogenic. TME with complex interaction between stromal and immune cells. Like tumor cells, intratumor heterogeneity is present in the TME with variable distribution and phenotype, and consequently favors resistant to treatment. Therapeutic options for patients with MRCC have expanded rapidly over the past decade, with targeted immunotherapy being the new cornerstone. Several emerging drugs are designed to enhance the anti-tumor immune response and are tested in ongoing trials. Thank you very much. That's it.